right, everybody, thank you for joining. We're just going to give it a minute or so and let people log on, and then we'll get started in about a minute or so. All right, thank you everybody for taking the time to be with us this afternoon. We have a very important topic that we're going to be talking about, sudden cardiac arrest in youth. Before we get going, one quick housekeeping item. We have a Q&A box. If you scroll down on Zoom, you'll see a Q&A button where you can type in a question, and we will answer all of those questions at the end of the webinar. So any thoughts, any ideas, any questions that you have that pop up, definitely throw them in that chat and we will take a look at them at the end of the webinar. So again, today's a very important topic. We're excited you took the time to join us. We're talking about sudden cardiac arrest in youth. And a lot of times, unfortunately, as a society, we tend to associate heart disease and people collapsing and dropping dead still with older people that are not healthy, people that do not take care of themselves, and or a whole bunch of different things. And of course, heart disease does affect those people. Well, sudden cardiac arrest and heart disease does not discriminate. It affects people of all ages, and that's what we're going to be talking about today. So as we go, first I'd like to introduce our presenters. So first of all, my name is Mike Pally. I am the manager of community relations here at Defibtech. I'm also a sudden cardiac arrest survivor and a heart disease patient, and all of this has had a really big impact on my life. And I'm joined by Martha Lopez Anderson, the executive director of Parent Heart Watch, which is an organization you're going to learn a lot more about, an organization that does amazing work. And Martha is someone that we work closely with, and we're proud to try to support a lot of the work that they're doing. So before we talk about sudden cardiac arrest in youth, just to give some brief background on Defibtech and who we are. So Defibtech is a leader and an innovator in the design and manufacture of life-saving resuscitation devices. Our medical technology devices provide easy-to-use resuscitation equipment. Public safety, healthcare providers, and bystanders depend on our products each and every single day. We are owned by a leading international medical device manufacturer, Neon Coden. And we are committed to designing and creating products that help communities around the world respond to sudden cardiac arrest. One of the things that we're very proud of at Defibtech is our mission. And we are a company that sells AEDs, but our mission ultimately is to increase survival from sudden cardiac arrest. Our goal each and every day with the work that we do is to help save lives. So our vision at Defibtech is to lead explosive growth in the AED usage and transform the pre-hospital treatment of sudden cardiac arrest. And in doing that, one of the things that we take pride in is aligning ourselves with key stakeholders in saving lives from sudden cardiac arrest. And that's organizations like Parent Heart Watch. So that's what we do at Defibtech. We are very proud of the work that we do. We know how important it is, and we need to make sure that we're aligning ourselves with organizations that you're going to hear about today. So with that, I am actually going to kick it over to Martha, and she is going to talk about the amazing work that she does with Parent Heart Watch.
Thanks, Mike, and good afternoon, everyone. And thanks also to our partner, Defibtech, for this opportunity today. So in today's webinar, you will learn about sudden cardiac arrest, what it is and what it's not, the incidence of sudden cardiac arrest in youth, how you can help protect young hearts, and the resources available to educate yourself and your community. So as the national voice solely dedicated to protecting youth from sudden cardiac arrest and preventable sudden cardiac death, Parent Heart Watch leads and empowers others by sharing information, educating, and advocating for change. Besides education and awareness, which are paramount to the work that we do, together with our action-driven members in 36 states, we have screened the hearts of over 800,000 youth, trained nearly 609,000 people in CPR and AED use, placed over 9,200 AEDs in facilities where youth congregate, and we have also affected legislation in numerous states. On the screen is a photo of my son, Sean, and his friends on his 10th birthday. He's the boy with the yellow t-shirt. Sean was rollerblading in our neighborhood when he collapsed in sudden cardiac arrest. Those that witnessed his collapse thought that he was just having a seizure. So they stood back, waiting for the seizure to end. It was not until a neighbor, who is also a registered nurse, noticed that Sean was not breathing and started CPR. Unfortunately, an AED was not available for more than 10 minutes later when paramedics arrived. Sean's heart was shocked several times, but it just quivered. It was too late. Sean had had a well child checkup just 1 month earlier, and according to his pediatrician, everything was great. Yet Sean is no longer with us. My family and I were totally blindsided by sudden cardiac arrest. And with this presentation, it is my hope that you don't have to be blindsided like myself and so many other families across our country have. So let's talk about the reality of sudden cardiac arrest in youth. It's not rare. Sudden cardiac arrest is a public health crisis in our country. An estimated 7,000 to 23,000 youth under age 18 are affected annually. It's the #1 killer of student athletes, the #1 cause of death on school campuses. Yes, that's right, #1 cause of death on school campuses, more than shootings and more than many other things that are discussed every day in our media. 95% of the victims die, but through heart screenings for early detection, that may lead to sudden cardiac arrest. And by being prepared in the event of an emergency, we can change this paradigm. So we know that CPR and AED use are effective in the treatment of sudden cardiac arrest. However, our survival rates have remained at less than 10% for decades. It's important for everyone to understand what sudden cardiac arrest is, what it looks like when it occurs, and motivate them to take action when second counts. So in simple terms, sudden cardiac arrest is a life-threatening emergency that occurs when the heart suddenly stops beating. It affects people of all ages, like Mike said earlier, who may seem to be healthy, including children and teens. When it happens, the person collapses and doesn't breathe normally. They may gasp or shake as if having a seizure. Because sudden cardiac arrest leads to death in minutes, it's really important that the person gets help right away. What does that mean? It means calling 911 to get help on the way, starting hands-only CPR to keep oxygenated blood flowing to the brain and other vital organs until EMS arrives. And also the 911 dispatcher can help, guide you through CPR if you don't remember or just don't know how to do CPR. And also using an AED if available as soon as possible to restart the heart's normal rhythm. So very often the terms sudden cardiac arrest and heart attack are often very interchangeably utilized, especially by our media, and they're not the same. So the best way to understand the difference is that cardiac arrest is electrical and heart attack is plumbing or clogging of the arteries. And it's fair to say that children don't have clogging of the arteries. So when sudden cardiac arrest happens, again, the person is unresponsive and not breathing. And it affects people of all ages, children, teens, young and older adults that may, seem healthy. So let's talk about why we do what we do. This is Nicole, and she was diagnosed with hypertrophic cardiomyopathy after her pediatrician heard a heart murmur at her 6-year checkup. Then in 2015, at the age of 10, she had a septal myectomy. Then fast forward to 2021. Nicole had a sudden cardiac arrest while she was in school. And because her school was prepared for the cardiac emergency, she received high quality CPR and 6 shocks from her school's AED, which saved her life that day. She now has an ICD, which is an implantable defibrillator. And this is Xavier. Xavier played football through high school and into college at Southeastern University, where he's a pre-med student. He was sidelined after the mandatory heart screening, or the ECG, required by his college caught a congenital heart defect, which is known as Wolff-Parkinson-White syndrome. He has undergone 3 ablations to correct the extra electrical pathways in his heart. And Xavier has now found his passion and purpose and is anxious to change the mindset of those involved with saving lives. He wants to become a pediatric cardiologist. And this is Julia. Julia was a high school student when she attended her screening event by the Eric Paredes Save a Life Foundation. And there she learned she had long QT syndrome. After follow-up, her mother and her brother were also found to have long QT syndrome. So through one screening, 2 additional lives were saved. Julia had to defer her plans to join the military and really had to adapt her physical activity, but she went on to develop a renewed interest in dance. And upon attending college, she founded a Saving Hearts Foundation chapter at Virginia Tech and has provided free heart screenings to high school and college students. So she's become a tremendous advocate, identified through a screening and now paying it forward. So I ask that you please take a close look at the collage of kids before you. Note the age range, gender, and race. Some died playing the sport they love, others at school, while others in their sleep. Every one of them, again, of these beautiful children was a victim of sudden cardiac arrest. We can and must do better to protect our youth, our future. The youngest child on this screen is in the middle, little Madison, blonde hair in the middle. She was just 5 years old. So again, sudden cardiac arrest does not discriminate. So after tragic and nearly tragic events, you may wonder why heart conditions that put youth at risk go undetected. So oftentimes youth don't report or recognize the symptoms. And parents or guardians just check the box, completing those PPE forms without asking their child about their symptoms. The youth that experience symptoms, often because they don't recognize it as potentially life-threatening, and also because it's their normal. If it's their normal, how are they supposed to let mom, dad, or their doctor know that they're feeling something? It's their normal. And the standard of care today, history and physical evaluation, which really there is absolutely no evidence that it's effective in identifying kids at risk, and misses up to 90% of youth at risk. Again, misses up to 90% of youth at risk. We can do better. So knowing the warning signs and symptoms of a potential heart condition is really critical, and asking your child, not assuming, asking your child if he or she has ever experienced any of these. So once you find out, if your child has, experienced any of these, then you can take additional action, sharing that with their primary care provider. But please don't assume that you know what your child is feeling or not feeling. Warning signs or symptoms should never, I say again, never be ignored or downplayed. Doing so could lead to sudden cardiac arrest. And as I said earlier, the current survival rate is dismal, less than 10%. So please seek medical attention immediately. So to help identify youth at risk from sudden cardiac arrest, Parent Heart Watch and its members advocate for electrocardiogram, ECG, or EKG screening, which is a quick, non-invasive, and painless test that measures and records the heart's electrical activity. It's very important for the electrocardiogram to be read by a medical provider who is proficient in the interpretation of ECGs in youth. That's really, really important. Something that we all need to do and be diligent about is gathering our family history and sharing it with the primary care provider so that he or she can ask appropriate questions and determine if diagnostic or genetic testing is necessary. So what does that mean? It's knowing if any family member in your any family member with heart disease, even if the condition was treated and remedied and corrected. Anyone that suffers unexplained fainting or seizures, unexplained sudden death of a family member under the age of 50. Those are really important to share with your primary care provider so that, again, he or she can ask the appropriate questions. So the causes of sudden cardiac arrest, there's many different ones, but congenital disease, those are ones that you're born with. Hereditary disease, those are run in your family. Acquired disease, that some Kawasaki and others. Viral infections such as myocarditis, which we've heard a bit about during the COVID epidemic. COVID-19 diagnosis or asymptomatic infection. And heart conditions that can result from abnormal heart structure or function. Also, an abnormality in the electrical system of the heart or the conduction system of the heart. A blunt impact to the chest directly over the heart. And that happens when at a specific time when the heart is recharging. And it could be, the impact can be by a ball, a bat, an elbow, a knee. This is known as commotio cordis. And lastly, drugs, recreational or prescribed, or stimulants that affect the electrical system of the heart, such as performance enhancing or high caffeine energy drinks or supplements and diet pills. So your medical provider, in the event that your child is diagnosed, your medical provider will inform you of the recommended treatment plan, which could include taking medication, making lifestyle modifications to reduce risk, which sometimes it means refraining from competitive sports, surgery to correct the issue, or implantable devices that monitor or treat your heart rhythm. For student athletes, it means that they will need clearance from a licensed medical practitioner according to your state's High School Athletic Association bylaws. And also, sorry, that's that. So last year, you may have heard that the American Academy of Pediatrics revised their 2012 policy statement on the prevention of sudden cardiac arrest and sudden cardiac death in the young. And what this policy does is it provides primary care providers with a strategy for screening, evaluating, and managing sudden cardiac arrest in youth during their physical examination. And they say, or at least every 3 years, especially upon entering middle or junior high school. And so they emphasize, again, awareness of warning signs and risk factors, a thorough personal history, family history, and physical examination, and ECG as a first test when concerned for sudden cardiac risk. And why do I have that in red? I will tell you in a minute. ECG interpreted by a trained physician. They suggest genetic testing for family history of sudden cardiac arrest or heart conditions. But what this policy does, it fails to address the asymptomatic child. And so many kids, 50% of the youth stricken by sudden cardiac arrest reported no symptoms. And there was also no significant family history. So again, we feel that this policy misses at least half of the youth at risk. So we continue to advocate for electrocardiogram screening to identify the kids at risk. So given that sudden cardiac arrest can strike seemingly healthy young people at any time, it's critical to be prepared for a cardiac emergency and prevent death. And so how do we do that? So we have to know how to recognize sudden cardiac arrest when it happens. Remember earlier, I tell you the person is collapsed and unresponsive. They may gasp or shake as if having a seizure. You need to learn hands-only CPR so you can double or triple a victim's chance of survival. Grab or send someone else to get the AED if available, and follow the audiovisual prompts. AEDs are for anyone to use. They walk you step by step. And also make sure your child's school is ready for a cardiac emergency. Please don't assume that they are. Also your after school care programs, sports league, camps, they need to be prepared. And how is that? With staff and volunteers trained in CPR and AED use, easily accessible and well-maintained AEDs, and a written cardiac emergency response plan that is practiced at least annually. And if you think about it, schools conduct fire drills regularly, way more than just annually. And yet, when was the last time that you heard of a fire happening at a school? We need to give priority to sudden cardiac arrest, just like we give, priority and importance to fires, potential fires in schools and other places. And so, again, we feel that in order to be prepared, these are the steps you need to take, and everybody can call push shock. So Parent Heart Watch has a vast array of free educational resources on our website, and also these are downloadable and for anyone to use. We have posters, fact sheets, postcards. We also have a phenomenal library of short videos, on-demand training modules for schools, athletic trainers and coaches, and even medical providers. And we also have CPR and first aid certification for a fee, with a portion of it being donated to our organization. So let's recap. We have gone over a lot of information. So sudden cardiac arrest in youth is preventable. Again, it's preventable, but that doesn't happen by chance. And so this is why it's critical that we learn the warning signs and symptoms of a heart condition, that we ask a child if he or she has ever felt any of these, that we gather our family heart health history and share it with the primary care provider. So again, that he or she can ask appropriate questions and conduct any diagnostic testing. That we complement our child's well-child checkup or pre-participation physical examination with an electrocardiogram, ECG or EKG. And that we learn hands-only CPR and how to use an AED. Again, make sure your child's school, after school care programs, camps, sport leagues are prepared for a cardiac emergency. And again, the resources available at parentheartwatch.org can help educate communities where youth live, learn, and play. I really want to thank you so much for taking the time to join us today. And thanks so much to Defibtech. Thank you again for learning about sudden cardiac arrest in youth and its prevention. Together, we really can change this picture, one heart at a time. This collage of photos, those in color, are the ones that survive sudden cardiac arrest or have been identified with a heart condition. And those in black and white are the ones that we have lost to sudden cardiac arrest. And we look forward to the day when we have color pictures, that we can have color pictures in the entire collage, as opposed to losing youth to a preventable outcome. So I encourage you to stay connected and informed. So like our pages, follow us on social media. We're on Facebook, Twitter, Instagram, LinkedIn, YouTube. So please stay connected with us and feel free to reach out. Martha, Martha at parentheartwatch.org should you have any questions.
Awesome. Thank you so much, Martha. I have been lucky enough to be a part of, different Parent Heart Watch events and gotten to know you. And again, want to say how inspiring the work you're doing is. And, it's obviously work that you do that gives people a chance to have their life saved when they're either going to sudden cardiac arrest or, like you talked about, hopefully before they're in that life or death situation with some preventable screening. So if you have any questions, you can still throw them into the Q&A section. We have a couple that came up. And the first one's an interesting one to me because, we do some of this work here as well. And it seems super obvious when you present the information, like why AED should be in schools, what programs should be surrounding them. But the question is, what are some of the obstacles that you've seen when it comes to getting AED programs in schools?
Well, Mike, I will say that the number one obstacle at times is funding, right? But there are ways to mitigate that. There's a lot of different opportunities. And again, we have information on our website. A lot of our member foundations place AEDs in schools and other places where youth congregate. We have our Get Charged Up program. Right now we have a summer edition of Get Charged Up, and we will have also a fall program as well. And so Get Charged Up is about cardiac emergency response planning in schools. And for every school that applies and agrees to the milestones of the program and completes them, receives a complete AED package. And that AED package includes obviously the AED with all the necessary accessories, including cabinets, signage, rescue kit. And so we want them to be ready, but funding is one. And at times, I think the other aspect is people not realizing that sudden cardiac arrest can happen. And so once they realize that it can happen at any time and not just in sports and not just to high school students, then they make it a priority. So having a champion in the schools can be really, really helpful in implementing an AED program.
Yeah, that makes a lot of sense. And to your point, I think a lot of times, again, this is a societal thing, but we tend to wait until something really bad happens before we act upon it. And I know one of the messages that we try to push is trying to be proactive rather than reactive. It shouldn't take a young child surviving cardiac arrest or unfortunately passing sudden cardiac arrest for a school or any building to get themselves prepared to help save a life. So
actually, Mike, if I could add to that, while funding to actually implement an AED program in schools is a reality, oftentimes what we find is that AEDs are placed, but they're either improperly placed, right? They're not properly maintained. And so they're not rescue ready. They're not ready when the event of an emergency. And so that's just as bad as not having an AED, right?
Definitely. That's a good point. So next question that came up was towards screening. So you talked about ECG screening and how it can be important in detecting heart disease. At what age would you suggest someone gets their first EKG, and how often would you suggest that EKG is repeated over the course of someone's life?
So in our world, we would love to see youth identified by the standard of care, including screening at different intervals. And so we would love to see the standard of care include screening at birth when children start school, in middle school, and again in high school. But until that happens, we believe all school-age youth should be screened every 2 to 3 years, or obviously, if exhibiting warning signs and symptoms. If they have a family history, that's a given. They have to seek screening, medical care.
Definitely. Makes sense. And last one that we have here, I've obviously personally known of all the amazing work you guys do at Parent Heart Watch for a long time. And one of the things that I think sometimes gets maybe pushed to the side, but is one of the really important things that you do, is kind of the network of support that you provide for people that have gone through something in their life, whether it's losing a child, someone that survived sudden cardiac arrest. Because a lot of times when this happens, it's hard to get connected to people that have been through something similar to you. So if you could just really briefly kind of just talk about why you think that's so important, because I think obviously the screening, the AEDs, and all the other stuff you're doing is obviously is great, but I also think it's really important and amazing that you've created this network of people that you bring together to support each other as they move on in their life after going through something like sudden cardiac arrest.
So thank you. That's a great question. And I will tell you from my own personal experience that when my family and I lost Sean, we felt extremely alone. And Parent Heart Watch found us, right? And then when we attended our first annual conference, where other parents from across the country that have been impacted by sudden cardiac arrest, they attend the conference. And this is where we come together to the network, the support, to learn, the latest on research for sudden cardiac arrest and its prevention. It's just, I can say a lot of things, but you have to experience it. But one of the things that was really critical for us is the fact that we could connect with others that could relate to our loss, and also that empowered us to do something that honored my child's memory. And then as the years went by, Parent Heart Watch expanded not just to include parents that had suffered a loss, but parents whose child survived cardiac arrest or was diagnosed with a heart condition. And it's really amazing to see what happens. We always say, give warning to sudden cardiac arrest survivors. When you come to the Parent Heart Watch conference, be ready to get a lot of hugs, okay? Obviously the work that we do each day is so that we have more stories of survival.
Definitely. It's amazing. So so we have one more slide just with some contact information. So if anybody wants to reach out either to us at Defibtech or Parent Heart Watch, some basic contact information. And Martha, I just want to thank you again for taking the time to share your story, talk about the work that you all are doing, because it's so important, and raising more awareness of sudden cardiac arrested youth is only gonna help save more young people's lives. So thank you again for taking the time to be with us today.
Well, I really appreciate you as a tremendous advocate, and the work that you do with Defibtech. And I will add a last little plug for Parent Heart Watch. Save the date, January 13th through 15th, 2023. We will be in Houston, Texas for our 18th annual National Heart to Heart. And so we will have information, the more details, a tentative agenda, and more details on our website really soon.
Definitely.
Thanks again.
Yeah, of course. And just one last message for everybody else. Again, thank you for taking the time to watch this really important webinar. The one thing we always ask is, we appreciate you being here. Thank you for taking the time to learn about this really important cause. But don't let it stop here. Take the information that you learned from Martha and share with your family, share with your friends. Encourage the parents in your life to get their kids screened. Encourage your family and friends to get trained in CPR and how to use an AED. Because the more people we have aware of sudden cardiac arrest and who it affects, ultimately, the more lives we're going to be able to save. So thank you again so much, everybody, and we hope to see you next time at our next webinar.
Thank you.